Our disability is our greatest strength. It gives us a supervision to see the issues facing humanity from a more inclusive perspective and the grit to fight back against all odds. Welcome to Super Adaptables, the More Than Walking video podcast discussion. Welcome to Super Adaptables, the podcast where people of all abilities gather to discuss pressing issues that affect the disability community and the implications for the world at large. We are your host. I am Corey Pheez, C4 complete quadriplegic since 2005.
And I'm Jonathan Sigworth, C7 complete quadriplegic since 2006, both of us hailing from the great state of Connecticut.
And autumn is in effect, so the weather is starting to turn, unfortunately. Drizzly rain, typical New England for you.
Unexpected downpours. No.
Oh my gosh. Outside it's cats, dogs, tigers, bears. But we're recording this on Thursday, the 25th of September, 2005. And in a little bit, we'll be discussing with some experts about Medicare, understanding the ABCs and Ds of health care insurance coverage.
And before we get into that, I just want to make sure that everyone knows that Super Adaptables is made possible in part by a grant from the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. The information provided and the opinions expressed in these podcasts do not necessarily reflect the views of the Christopher and Dana Reeve Foundation. For more information about the Foundation's National Paralysis Resource Center, visit www.christopherreeve.org. Also, I should note that the views expressed on this podcast do not necessarily reflect those of More Than Walking either, but belong to us as individual speakers. And with that, we'd like to welcome back two of our previous guests, Heather Miller, who's joining us from Nebraska. Heather is a certified benefits counselor at Spinalpedia, which is a partner of More Than Walking. Through them, we help provide one-to-one mentoring and peer navigation for people with new injuries, anyone who's living with the SCI at any point in their life, connecting them to legal resources, as well as helping them navigate the whole system of supports on the path to employment, navigating insurance, connecting with adaptive sports, anything you can imagine, Spinalpedia can help. So really happy to have you back, Heather.
Thank you. Glad to be here.
Absolutely. And also, we would like to introduce Joe Short, an independent living advocate working for Independence Northwest. More Than Walking is working with their organization to get the word out here in CT about social safety nets and what changes can be made so that current and future generations can continue to benefit from these programs. And we hope that these discussions will serve as an example to those of you viewing out there. So thank you both for being here. So, in preparing for all of this, I was thinking about how often we reminisce about our youth when life and the world seemed less complicated. For example, do you remember kindergarten and learning your ABCs? Those lessons were fundamental to your growth and development. But sadly, as we age or become disabled, we're forced back into the classroom-like setting again, where you're being given directives, needing to be closely monitored sometimes, or relearning a new system. In many ways, we return to that childlike state in one way, shape, or form.
I mean, sadly, but it's also, Corey, it can be a challenge that can be invigorating and exciting to learn something new. So just to keep that spin on it. But that's so true, Corey, and as the saying goes, once a man, twice a child. In the latter stages of life, or if you acquire disability along the way, you may need to be taken care of, or that comes with learning the meaning behind another set of fundamental ABCs and Ds. Medicare, a government-backed health insurance for adults with disabilities and people aged 65 and over, is broken up into these four separate lettered tiers. In our previous episode, we've learned that and discussed that Medicare Part A covers hospital stays, Part B covers doctor's visits, Part C is Medicare Advantage, or Medicare plans offered by private companies, and Part D covers prescription drugs. When you spell it out, you'll find out that it's not as easy as school was. However, it's fundamental in providing healthcare coverage should you become disabled or reach the age of retirement, as things stand today. By the way, Corey, I've been reading this great book that I just want to plug that explains in great detail how we came with Medicare ABCs and Ds.
Mm.
The book is called Medicare for All: A Citizen's Guide by Abdul El Said and Micah Johnson. And just in short, uh, as insane as the splitting up of Medicare policy is, as we're going to discuss in great detail, um, it's not necessarily how it was originally envisioned, but it is as the result of the political horse trading and negotiations between different parties in order to get something like Medicare in existence. So just keeping that in mind. But it's a great book that people can listen to for free with your public library card number on Hoopla, which is a great app. Just to put that in there.
That's definitely a nice plug. I've been wanting to get on Hoopla. Our town recently just built a brand new library. So I'm quite sure my library card has expired from the previous place, but I definitely plan on getting one and tuning into that book because it sounds very interesting. Because as we know, Medicare is a government-backed insurance program that is designed to help you should you become right disabled or once you become elderly. But if you have parents that got cell phones and or older aunts and uncles, they find those things complicated. So trying to navigate Medicare and insurance in general is very tough. But I'm so happy that we have Heather here and Joe to be able to walk us through some of these fundamental questions. So, beginning with question one, how is Medicare different from Medicaid?
Great question. So Medicare is a federal program administered by the federal government. Medicaid is a state-based program that is directed by each individual state. So there is no blanket Medicaid eligibility that is the same across the country. Each state has the ability to make their own eligibility categories. Medicare is federal, though. So that would be the biggest difference.
When the government looks at insurance in this light, are they trying to be competitive alongside private insurers, or do they kind of fall back and say, we want this kind of free market activity where we're not, going to be solely responsible for everybody. So, you know, if you want to go shop around for insurance here, you can, but the government is only going to go do so much for people who are eligible for this program.
The interesting thing with Medicare specifically is is that you're basically forced into it at a certain point and really don't have a choice. So, for instance, if you retire um, and you're of Medicare age, which is 65, if you don't enroll um, and you don't have employer-sponsored credible coverage through your employer or a spouse's employer or a parent's employer, you don't have to take Medicare, but if you ever do, you're gonna have late enrollment penalties for the rest of your life.
Does that,
So,
sorry,
oh, go ahead.
I was going to say, does that vary depending on what type of job you have, like in terms of income?
Um, Medicare typically doesn't look at income unless you get into that upper six-digit range, at which point they could apply something that's called an IRMA, income related monthly adjusted amount. So you'd essentially pay more for your Part B. As an example, I have a gentleman I work with. He has a very important job in the medical field, and his Part B, instead of being $185, is in the $520 range because of his income, if that makes sense.
I got you.
Did I answer the question there, Corey? I'm not sure if I did or not.
I think we can come back. I mean, I think that's also like related to like the impact of asset and income levels and things like that, or like the pros and cons. Didn't know about the penalty for late enrollment. So,
Yep.
but I think it would be helpful to go in order so we understand what the differences are between the different components first before we go deeper.
Sure. Yep.
So Heather, who manages Medicare policy and how is Medicare funded?
So CMS, Centers for Medicare and Medicaid Services, it's a federal agency within the U.S. Department of Health and Human Services. They administer the Medicare program. They set policy, they oversee enrollment, pay providers, they do the contracts with private insurance, and that's when you're looking at a Advantage plan or Part D, because the Part C is Advantage, Part D is your drug plan, because those are with private insurers. They ensure all that compliance. The broader policy direction and funding authority is Congress. That was created under the Social Security Act of 1965. So Congress is basically setting policy. CMS is making sure their bills are getting paid, people are getting enrolled, and they're in compliance.
So every time I'm paying taxes on my income, part of that is going to paying for Medicare later on when I retire at 65.
Yep, it's called your FICA taxes. FICA, Federal Insurance Contributions Act. That is what is that money is going to.
So I guess I have a question with regard to that. It's like how I don't know if you know the figures or what have you, but if that's kind of like the process that everybody's going through, what is like the concern that these programs kind of have difficulty being funded? Like, just in your opinion, like, if everyone's contributing to it, forcefully contributing to it, why would like the system kind of break down, I guess?
It's a great question that I don't know that anyone has an answer to, other than, and again, this is just my opinion. When you have individuals that in Congress that are basically, they're setting the rules, they're setting the laws. And a lot of times, those of us out here just working and doing life, we are not the same. We're not the same. And, we're kind of beholden to what they say is going to happen. Of course, we can elect people, we can, elect somebody new, but there's only so much that person then can turn around and do for their constituents, because they've got to convince how many other hundreds of people.
Yeah.
So that's just my opinion.
I also read one of the cons are that original Medicare has no out-of-pocket maximum. It may require Medigap plans and Medicare Advantage plans, but they often have restricted provider networks and potential prior authorization and potential enrollment confusion.
That's a very good point, Corey. And I discuss this with almost every Medicare beneficiary I counsel. You're correct. There is no out-of-pocket max like there is with a traditional health insurance plan typically. And so on the doctor side, you're liable for 20% of your entire bill. If you have a $100,000 doctor bill, you're liable for $20,000 of that. Here's another issue. When you are turning Medicare age based on age, 65, you have a 7-month window, 3 months before your birthday, month of, and 3 months after, to have a guaranteed issue for a Medicare supplement or a Medigap plan, which would then cover those coinsurance, deductibles, copays, those kind of things that original Medicare doesn't. So during that 7-month window, if you're getting Medicare due to age, insurance companies have to insure you. They can't say, well, you have this, and this. No, they have to. The same, however, is not true for someone on Medicare under the age of 65. So that's where we run into just exorbitant out-of-pocket costs. I try to do everything I can to get my beneficiaries in a Medicaid buy-in program if they're working, so that Medicaid can be a supplemental secondary insurance to cover like what a Medigap plan would cover. Your Medicare Advantage plans now are typically set up more like a traditional health plan with a private insurer. So they may have, you know, a $2,000 deductible, 5,000 out of pocket max, or what have you. But then you run into the issue of, does my doctor or facility take that private insurance company? And that can, we just had a gentleman in Texas who got into a Medicare Advantage with a very well-known carrier. He had a horrible accident, spinal cord injury, and the rehab they wanted to send him to does not take that Advantage plan, but they would take original Medicare Parts A and B. And that's the scary part of the Advantage plans. Excuse me. I feel like sometimes, again, personal opinion, private companies who are selling Medicare Advantage plans can sometimes target vulnerable populations like our elderly to sell these plans. Do I think everyone does that? Absolutely not. Do I think it's a problem? I absolutely do. Fortunately, if you get into an Advantage plan and don't like it, you kind of have a 12-month remorse time where if you go back into original Medicare A and B from an Advantage plan within 12 months, that's totally fine. It's not a problem. But after that, it does become an issue. And then, you know, getting the supplement back and stuff like that, or the Medigap, can be difficult. So it's me personally not a fan of Medicare Advantage plans. Now, it can be a really good option for someone under 65 that can't get a Medigap plan, that wants that protection from no out-of-pocket max. But you are not required to issue it, which means you're subject to underwriting. So imagine with your level of injury, Corey, how much a supplement would cost you to your Medicare. It would be astronomical if they even chose to underwrite you.
This sounds so treacherous. And you mentioned a couple of things there. So we mentioned Medigap. I don't know what letter that is.
It's a Medicare supplement. It's not a letter.
Yeah.
So just to again give us some context to build off of, can we lay out what are the different parts, and I guess now I should say versions of Medicare in general? What do they cover, and to what percentage typically? And I guess we can go as deep as you want for that, but just give us the lay of the land.
Okay.
Because like, what's the difference between traditional and like what, like, expect, like, we start with A, B, C, and D. That's all I know. Give us the next level down the rabbit hole of understanding like the subgroups and what that usually means.
So those are the parts of Medicare, period. You're not going to have all four of them. If you have a Part C, you have Part C and that's it. Advantage plan. The other is the traditional Part A and B. And hopefully you got enrolled in a Part D drug plan, or else you're going to have late enrollment for that too.
And A is hospital, B is doctor's visits. And
D is prescription drugs.
And Part C is Part C, correct me if I'm wrong, is that supposed to be a combination of A, B, and D?
It's an Advantage plan. Part C is Medicare Advantage.
So
what is that?
Cover Part A and B typically with other benefits?
I'm sorry, can you repeat that?
Doesn't Part C cover Part A and B and some other benefits like dental and visual at times?
It could. It's going to be like you went and bought a Blue Cross Blue Shield policy.
Correct.
So it's going to pay what Blue Cross Blue Shield has agreed to pay the providers that are in network. I just completely lost track of thought.
So it can vary is what you're saying, depending on who's selling it. It's not
and where you live.
They're not all the same. Yep.
I know the county, I live in a very rural county in Nebraska. I think there might be one Medicare Advantage plan available, and that's it.
And to be clear, it doesn't include traditional A and B. It includes kind of a version of A and B that is much more limited.
Potentially, yes.
potentially.
Now you still pay your Part B premium amount. So you're still paying that $185 premium amount, but then that's where CMS comes in to work with these private companies who are issuing Advantage plans or Part C plans for beneficiaries.
And by that, you mean CMS is dictating across the board here for certain parts what the prices are, whether you're getting it from a Medicare plan or whether you're getting it from an insurance plan. CMS dictates certain prices.
Yep. Now there can also be an additional premium due for an Advantage plan. I have seen that happen. You know, kind of more if you want to go with more of a platinum kind of standard plan, you pay the 185 as you'd normally pay for your Part B premium, but then there may be an additional amount you pay as well for that
So
particular plan.
so everyone who is on Medicare, like if I turn 65, everyone is paying a Part B premium is across
Unless
the
you
board.
financially qualify for it to be paid for you.
And is that the only premium that you're charged? You're not paid for a Part A premium?
Part A is free unless you are a very high wage earner. We're talking upper 6 digits, okay? Part B
And
is
then
the
to-
185. Part D, your drug plan also has a premium that's, I would say anywhere, I've seen anywhere from a couple bucks to 70.
But you have to buy that plan. That's
Correct.
not included. You have to
Correct.
opt in.
Correct. And you have to know to opt in so you don't have a late enrollment penalty when you finally realize you don't have it and have to opt in.
Okay, well, we'll get to the late enrollment penalties in the next question.
Yep.
And then what else are we missing here? What is Medigap?
Medigap is your supplement, Medicare supplement.
What is that?
That is a policy that you can buy. That's when I was talking about, you know, if you're under 65, they're not required to guarantee issue that. So you're subject to underwriting. You can have an astronomical premium. When you turn 65, okay, here's the thing. If you're 65, my full retirement age is 67. So I will still have credible coverage from an employer up to my full retirement age at least. As long as I have credible coverage through an employer, my spouse's employer, or if I'm younger and my parents' employer, then I don't have to sign up for Medicare. And then I keep that 7-month guarantee issue on the supplement. And that is what's going to pick up coinsurance, copays, deductibles that Medicare doesn't pay. It's a private company. So my
Gotcha.
mom, for
It's a
instance, she's
supplemental
78.
insurance.
Yep. She has a supplement with Blue Cross Blue Shield. So she has original Medicare A and B. She has a Part D plan. And then she has a supplement with Blue Cross Blue Shield. She pays probably $300 a month for.
Which,
But when she goes to the ER or she goes to the doctor, she doesn't pay a dime.
so it is basically, and we have Joe coming on, but it's basically like a loan within a loan. Like, you know, when you go for
A loan to pay for a loan, yep.
the loan to pay for the loan, right? Like, okay, you're paying, you know, X amount of dollars per month, like a fixed rate, just so that you can get out of your co-insurance. But at the same token, you're having money deducted just to make sure you're covered with like your overall kind of like umbrella policy. Like, I mean, you really have to have saved up during the course of your life and try to stay as healthy as possible
Yeah.
to make these things happen. But, you know, I have so many questions based off of what you just said. But Joe, welcome. To
Hi, Joe.
Good
Adaptables.
afternoon, guys.
You know, we're just jumping into everything. We're just, you know, really breaking down the different parts of the tiered letter system of Medicare. And, you know, I want to kind of like pivot a little bit towards people and persons with disabilities based off of what you said earlier, Heather. Like someone with my level of injury, high level quad, you know, that's if I can get certain coverage with underwriting, which I've ran into issues with that with life insurance, but that's a whole different
Yep.
conversation. What concerns me about Part A, you know, reading into it, you know, being that it covers inpatient hospital care, skilled nursing facilities, hospice, and some home health care. But I know sometimes, like, if there's a person who needs 24-hour care, that's not going to get covered. Am I right or wrong on that assessment?
You are absolutely 100% correct. And Medicare, and I can speak on this from personal with my father, wonderfully handles all things hospice above and beyond.
But it's only
Um,
100 days. Not that most people last longer than 100 days, but it's only 100 days that they'll cover hospice.
Wow. So,
But when they do cover it, they cover everything.
Yeah.
There was nothing we went without when my dad was on hospice.
so
I had a grandma who actually graduated from hospice and lived 5 more years.
Wow.
Yeah.
Wow. So then, like,
Corey,
sorry, go ahead.
sorry, just because Medicare is so confusing, I just want to make sure we continue having this in a very structured way. So, can we fold your question into pros and cons of enrolling in Medicare, Part A, B, Medicare Advantage, Part D, Medigap, and then considering before 65, after 65, meaning late, or whatever late means, I'm not exactly sure, and with like a chronic disability. And Joe, we just finished talking about the difference of Medicare and Medicaid, who manages Medicare policy, how it's funded, and just the different parts, what they are.
Excellent.
But we'll continue here if that's all right.
So are you talking, Jonathan, I'm sorry, are you talking about the late enrollment penalties, or is that what you're talking about?
We've talked in length about that.
Oh, okay, all right.
Yep.
Yeah, that's what Heather was mentioning. So I guess in response to that question, kind of folding in our discussion a little bit, let's go down the line. So part A and B, Heather, you start us off. What are the pros and cons of enrolling in Medicare for A and B, like traditional Medicaid, in those circumstances?
At a certain point in your life, you really don't have a choice almost. You have to enroll in it, or you have all these late enrollment fees. I don't know, Joe, what do you think? What are the advantages of?
Well, I don't think you should group them into the same category.
No.
Part A is
okay, Part A.
Part B is doctors. And, enrolling in Part A, unless you don't have enough quarters in, isn't going to cost you anything. There's no loss. It's
Right.
all pros. As long as you qualify for it, it's not going to cost you anything. But it is going to cost you if you don't enroll, and it will cost you for the rest of your life if you don't enroll. So it's one of those things that it's not going to hurt to enroll. You're going to gain stuff, and you might as well do it. As far as Part B goes, if you have
well, before Part B, can you explain what happens if you don't enroll? Like, what is we've heard about a fee. What is the fee? When, like, how much time do you have to enroll?
I'd have to look that up. I can't remember exactly. I believe it's
I think it's like 2 months before eligibility month, or 3 months before the month of and 3 months after.
yeah, exactly. So you have 3 months before that you can enroll, the month of your 65th birthday, and then 3 months after. And then after that, it starts, there's a percentage for every month that you go after that period.
So that can add up. We're not talking
yeah.
about a small annual fee.
Oh
This
yeah,
is-
absolutely.
Okay.
Absolutely. Like I've run into people that, are 85 years old. The only thing that they've ever taken in their life is a Tylenol. So they didn't feel the need to enroll in any of these programs. They've saved the government, tons of money by not being enrolled in them, but then they end up having to pay a penalty
Yep.
because they were healthy. It doesn't really make sense in that case. And it's happened a lot. There's there's a lot of folks that are on medications and everything, but they're the healthy folks. They don't really know that they're going to get penalized if they don't sign up for it. So it's just a matter of spreading that word about it.
I think
And
that
too bad I can't. Sorry, Corey.
No, I think that was part of my question earlier about the penalties. Is it based off of, how much you're receiving when you're retired? Like, are they going to charge you more if you're, like you said, if you're in the upper echelon of six-figure earners? How does the government kind of calculate the right amount of money to penalize you for, or is it like a flat rate?
It's a formula. Oh gosh, Joe, do you know the formula?
Oh, we don't need to go that deep.
Yeah,
It's a whole
really-
formula.
It's
It's a complex formula. I don't even know
I guess,
if they know exactly how to do it.
But I guess that's
and
I think it's not that we need to go into the formula, but I think it's important to know for our viewers that, should you, when you find yourself getting ready to retire, or just all of us, who are going towards retirement age, if you don't know these things, right? Like, enrollment period is going to start up next month. You know what I mean? And it's like trying to be abreast that, it can be problematic for your checkbook if you don't.
So
know.
the penalty is 10% of the monthly premium amount, and you'll pay that extra amount for twice the number of years you waited to enroll.
Wow, that
And-
sounds like a board game.
oh, so it's retroactive. It's not like
Oh yeah.
they notify you. It's like, 10 years goes by. Then you're like, oh, I want to sign up now. You get charged for
20 years.
Oh.
Yep.
Oh, I mean, this
And there are
begs the
two
question
ways.
why.
There's only two ways that the late enrollment penalties can stop. That is if you qualify for Medicaid at any point, then your late enrollment fees will go away. Or if you accrued them under 65, when you turn 65 and get Medicare based on age, that will reset.
And you also, if you qualify for the Medicare Savings Program.
Yes, good.
Okay. Begs the question, why don't they just automatically enroll people? But maybe
I
that's a
can tell
question.
you under 65, a lot of times they will. If you don't do anything, they will auto enroll you, and then they'll auto enroll you into a drug plan that may or may not be a good fit for you.
But they won't auto enroll you if you're after 65. I mean,
No.
Oh,
which would make sense.
I don't
'cause that
think
would
so.
avoid this
No, because you
whole-
could still be working and
So-
have work insurance and all of that.
Yeah.
But you can always,
Um,
like Joe said, take the Part A, it's free. You can opt out of Part B if you've got a, work insurance or something like that.
So
Okay, so Part A, all pros, it will cost you significantly if you don't enroll.
Yeah. I just wanted to add one thing to that, just because I have my signing up for Medicare book open to kind of answer one of those questions. If you're already getting benefits from Social Security or the Railroad Retirement Board, you'll automatically get Part A and Part B starting the first day of the month you turn 65. If your birthday is on the first day of the month, your Part A and Part B starts the first day of the prior month.
So here's what I recommend. When you're getting ready to turn 65 and or retire, you find your local SHIP office, Senior Health Insurance Information Program. These are the experts. In Nebraska, it's run through the Department of Insurance. Find your local SHIP. Just Google SHIP, like a boat, SHIP, and find your area SHIP and make an appointment with them to help you through this.
Absolutely.
That is good advice. All right, so we got Part A. Part B is up.
Part B gets a little bit more complicated, especially if you have employer coverage, because you don't have to enroll in Part B if you have considerable coverage, as long as you have, is it 15 employees?
That sounds right.
Yeah, and they have to have a certain amount of employees in order to be considered considerable coverage. And once you stop working, then you have a special enrollment period. But the key part is that Part B does cost right now. It's $185 a month premium, and that is what turns people off from wanting to obviously enroll in it and spend that extra money, especially if they're healthy.
Right. And I often advise individuals I work with who are primarily under 65 on disability that you can opt out of that and keep your work insurance. Just compare them both and see which works better for you, which is less expensive, and go from there.
And most of the time, work insurance is better coverage.
Right.
So keep your work insurance for as long as possible, and then you get a special enrollment period once you stop working to be able to opt into Part B with no penalties. If you just plain and simple decide not to take your Part B, once you do try to enroll, for every 12-month period after your 61st birthday, you're going to add a 10% premium to your payment for the rest of your life.
Okay,
Yep.
so it has a similar. It sounds like a more costly fine than if late
Absolutely,
enrollment
yeah.
for A.
Yep.
That 180.
A lot of people do qualify for the Medicare Savings Program, which pays that Part B premium, and the Medicare Savings Program definitely covers. I think it's up to what, 3,000 that you can be making, and still be covered for your Part B premium.
I think it's 138 of federal poverty level, 138% of federal poverty level.
Yeah.
That would be the SLMB, the SLMB, specified low income.
Yeah.
The QMB, I believe, that covers pretty much everything that
QMB
Medicare
is
doesn't, is federal poverty level.
Yep.
Or below.
Yeah, there's 4 different levels of the Medicare Savings Program, and each one has different income limits. But on the same token, if you qualify even for the lowest tier, it covers that Part B premium.
Okay, so that was going to be my question. What happens if you can't afford that Part B program? The solution is enroll in the Medicare Savings Program.
And the nice thing about the Medicare Savings Program is it only takes into account your income. It doesn't count assets.
That is nice.
Yeah, because
so it's a little easier for married couples.
Absolutely. Or if you've got retirement or anything like that.
Yep. Let's see. Any other cons to enrolling in Part B or the Medicare Savings Program?
The Part B, there's no out-of-pocket max. That's my biggest concern with Part B.
Oh, and that's both before and after 65.
Yep.
Or with a disability, just for everyone, there's no out-of-pocket max.
Right, 20% coinsurance.
Yeah.
Ooh, that's a sweet deal for providers.
Mm-hmm. Which is why I would typically, if I had a work plan that normally would have an out-of-pocket max, I'd keep that and opt out of Part B.
So even if you have a Medicare Savings Program, is that still the case, or that Medicaid Savings Program takes care of that as well?
QMB does. SLMB only takes care of the Part B premium.
Yeah, but
what is the QMB?
Qualified Medicare beneficiary. That means you're federal poverty level or below.
And if you qualify for the Medicare Savings Program, you could also qualify for what's called the DSNP, which is a dual eligible special needs program. And that's the same thing as having a supplemental plan. And a lot of these supplemental plans are, $400, $500 a month. but because you qualify for the Medicare Savings Program, you qualify for the DSNP, which is the same, which is free. I know that's a lot of typing there, Jonathan. Sorry about that. But
These are just my notes, everyone. I'm just trying to follow the thread here.
so there are ways around it if as long as your income is within the limits. Otherwise, it can be quite costly.
Yep.
Yeah. Okay, so if you're poor and you have a disability and you get Medicaid Part A and Part B, you're likely eligible to be able to afford it because there are these other programs
Exactly.
that can help pay for it. But
Yep.
if you're not in that category, Part B does come with these added costs. Is the
Yeah.
kind of main takeaway
Mhm.
Yeah.
and pitfalls to be aware of. Okay.
And a lot of times people can be eligible for the QMB, Medicare Savings Plan, and Medicaid. But the important thing to remember is that QMB is only paying the things that Medicare would cover. So if you look at personal care assistance, you're going to need Medicaid for that. QMB is not going to cover that because Medicare doesn't cover that. Does that make sense? So I see a lot of people that have both QMB and Medicaid, which is essentially, Joe, correct me if I'm wrong, QMB is more paid by federal
Yeah. So
versus
QMB is paid by the state, but there are a lot of people that when I tell them, and they're looking for home care or anything like that, I tell them that I ask them if they're on Medicaid, and they're like, "Oh yeah, no, I have QMB," and it's like, no, QMB is going to pay for your Part B premium and some of your drug costs, but that's about it. And in order to actually get that home care, you need to be on Medicaid or pay out of pocket.
I have a
correct.
quick, I have a quick question. A lot of our viewers are people with disabilities and may have been injured early on. So, are there certain like kind of work requirements that you have to meet in order to receive Medicare if you've been disabled before you turn 65? Like, where does that money have to come out of or come from in order for somebody with a disability to be able to qualify for Medicare?
So,
So if you qualify for a Title II disability benefit, SSDI, Childhood Disability Benefit, formerly known as DAC, or Disabled Widower's Benefit, after 24 months of benefit payments, you are Medicare eligible. So it relates to if you have enough work credit history to get one of those, or you're a disabled adult child and your parents are drawing, then that makes you eligible.
but for those that
Medicare.
don't have the work credits, whether you're disabled or not, there is a Medicare buy-in program that you could. I mean, so it still would end up costing you. But say you're an individual on SSI or someone who doesn't have work orders in when they reach retirement age, there is a Medicare buy-in program.
Yeah, I believe.
And is that the same as Medicare Advantage?
No,
Mm-mm.
Okay.
no.
Of course not,
Medicare-
Jonathan.
Yeah, Medicare Advantage is instead of having traditional Part A and B, you have an Advantage plan that would have like A, B, and D all wrapped up into one, and it just makes it easier for an individual. Say somebody doesn't have a preferred provider network, and they don't have a lot of medications. They don't travel out of the country. That might be a good plan for them to get because everything is all wrapped up into one. They don't have to pick and choose. A, B, and D are kind of a la carte, whereas the advantage plan is a Happy Meal, everything wrapped up into one.
That is a great way to describe that. I'm saving that.
Have you had your break today?
All right. So, okay, there's a lot more letters in this list. I don't know why we stopped at letter D. Okay, so we've covered Part A, Part B. medical savings plan, qualified Medicare beneficiary, dual eligibility. Let's talk a little bit about what we were just discussing, Medicare Advantage. What are the pros and cons of those private plans? Those happy meals, if
The
Or-
provider you use or the facility you use has to take that private insurance company.
Yeah.
That's
So the pro is that, you know, everything is already wrapped up into one. It's very neat and clean. But, you know, if you're traveling out of state or out of the country and you're not in that provider network, then you're going to be paying out of pocket. Or you're just
Yep.
not going to be able to see that doctor that you want to. And problem is that you might be working with a doctor that you've been with for years, and then you switch to an Advantage plan, and you don't do your research ahead of time and find out that that doctor is not in that network. So you've got to end up switching doctors. On the Medicare.gov website, when you're comparing different plans, you could actually put in the medications and the doctors and be able to make sure that your doctor is within the network of that plan that you're looking to purchase, so that you don't have to go and switch over and then, you know, a couple months into having this new insurance find out, oh, this medication isn't covered or that doctor's not covered.
Right.
So you can know in advance who's within that network of that plan.
Hey, I had a quick question, just kind of going back to the difference between like Medicaid and Medicare. Like once you're a recipient of Medicare, if you cross state lines and you're living in another state, you don't have to worry about like re-enrolling or anything, right? Like nothing changes.
Nope.
no. You just do if you move, you do an address change with Social Security.
Okay.
but I guess to Joe's point, if you have Medicare Advantage, that is not the case. I guess you don't know. Like it all
You don't
depends
know.
You really
because
don't
those
know.
Medicare Advantage, those are national plans. But again, it's
Yeah.
Yeah, the doctor in the new
Right.
place that you're at may not.
Yeah, I mean, it doesn't necessarily have to be out of state. It could be on the other side of town.
Yep.
That, you know, one doctor takes it and the next one doesn't. So yeah, it's not necessarily out of state or out of the country. It could be, you know, on the one side of town compared to the other.
and I guess
Well-
that
And I think-
also does that include the same risk? Like if I'm like traditionally, like if I have an emergency and I want to go to the nearest hospital and I'm worried that it's an in-network hospital, if like I'm on a private plan, do you have that same fear if you're on a Medicare Advantage?
Absolutely, yeah.
Oh shit.
You might be paying out of pocket.
Yeah.
Do they have?
Yep.
Wow, that's crazy. So, like, is there kind of like a national database of like providers, like based on like each state? I know it would be like an exhaustive list, but like where maybe you don't have that concern or that fear. Because I know when I got hurt and they put me in the back of the ambulance, some of the first questions they were asking me was my name, social security, and they kind of want to know who to bill at the end of the day. Does the government offer anything like that, like in Medicare, to let you know so it's not a guessing game when you're trying to figure out who can cover your healthcare cost or not, or it's just surprise, like let me call this doctor ahead of time and see if they accept my
Before you switch to a Medicare Advantage plan, I would identify which one you think you want to switch to and contact all your providers to make sure they will take it. Because they don't have to. In my experience, facilities and doctors more often take traditional original Medicare A and B versus some of the Advantage plans.
Gotcha.
So it's very important, you know, if you've got a certain specialty doctor that you know you've worked with your whole life that knows everything about you and your condition, you don't want to lose that person because of insurance. And the only way to find out is to call them ahead of time or the trial and error method, which is not good for anybody.
Yeah, but I guess to your point, Corey, that there's no app that knows your insurance plan, and you say, find me the nearest in-network hospital and take me there. Like that doesn't
Like
exist.
you can Google, you know, Dr. Smith's family practice, and see what insurances they take. But there's no, now, when we're looking at some of the Medicare Part D stuff, then you can get on Medicare.gov, put in the drugs you take, where you live, what pharmacy you want to
Right.
use, and it's
Yeah.
going to tell you if it's covered.
That's
So
that's
that
what
we have
yeah.
that, yes.
Okay.
All right,
But
so
yeah,
let's.
you really have to do your due diligence in checking before you make that switch.
That's it.
So Medicare.gov is the place to find who's in network, whether it's Medicare Advantage or Medicaid Part D.
Yeah.
Let's talk about Medicaid Part D, pros and cons before 65, after 65, people with disabilities. Go.
I'll use what Joe said. It doesn't cost a lot, so it's not free. But if you don't take it, you'll have a late enrollment penalty. So
Again?
Yep. So Part D is the prescription drug, obviously, and that's done with a private insurance company. And it's solely based off what drugs you take and where you want to pick up your prescriptions, what pharmacy you want to use. So if you say, I want to get mine at Walmart versus a small mom and pop pharmacy, it might be cheaper at Walmart. You know, you just kind of have to, and you can do comparisons. And that's why when I really point to your local ship office, because they should be well versed in this and be able to just right through that. For example, when my mom redoes her Part D plan, she brings her bag of drugs because we need to know, is it a tablet or a capsule? That could be a difference. Bring that bag of drugs. I can tell you, at one point, my mother was in the hospital with nasty, horrible COVID. It was during open enrollment. Her doctor switched her insulin brand, and we found out it would not be covered. So I had to do some really quick maneuvering to get her back into the old Part D plan that would cover the new, the Traceba, or she would have been paying out of pocket for her insulin.
It is like the difference between can I get it at Walgreens or CVS? Who carries it?
Or we don't cover that. This insurance company doesn't
Yeah.
cover that medicine.
Damn it.
And that's when you start looking at like pharmaceutical assistance programs where you could maybe get some of that based on your low income for free.
Right. So do the same programs that help people pay Part B, like Medicare Savings Program or the QMB program, does that help pay for Part D too, or is it a separate system?
So Part D, and I think Joe must be frozen. Part D you can qualify for what is called low income subsidy, LIS, or extra help. If you're Medicaid eligible, you're automatically LIS eligible. And so that can pay that Part D premium. It caps your drug costs. I don't have the 2025 numbers memorized, but if you have the extra help, you typically won't pay over $11 and some change for a brand name drug.
Yeah.
And I'll let you, Joe. You've been frozen for a while.
You're right. The LIS program, if you're in the covered by QMB or the Medicare Savings Program, you're not going to be paying much of anything for your Part B or Part D premium or even your prescription drugs. So it does, once again, as long as you're as long as you're poor, you're good. Anyone who has any money and doesn't qualify for those programs, that's when you run into continual problems.
Yep. And you can change your Part D plan every year. There's open enrollment. I believe it's October 15th through December 7th. Does that sound right, Joe?
Yeah, that's absolutely right. Yeah.
Okay. And I encourage everyone, even if you don't make a change, to go back to your SHIP office or go to Medicare.gov, enter your stuff in and see if anything has changed. Because there may be the Part D plan you've had for 20 years no longer covers this maintenance drug that you take. And so you're going to pay out of pocket for that. And so you want to know that before that happens.
So to be clear, Part D, this is always a private plan. This is not a government. So, okay. So there's lots of options. There's lots of Part D options to choose from. just as there are lots of different Medicare Advantage plans to choose from,
Yes.
and it determines which drugs they pay for or not.
And
Is
what
there a way
pharmacy?
is there a way to enroll in a plan that pays for all the drugs everywhere?
No,
Is that an option?
not that I know of.
No. So even if you're disability low income, you need to choose the right Part D plan.
Correct. I had a lady come in one time when I was working at a previous job where I had an office, and she was on disability and was getting 900 and some dollars in Social Security disability a month. And Medicaid had auto enrolled her into a Part D plan that did not cover any of her insulin supplies. So we got her enrolled into a different Part D plan, and her out-of-pocket costs without that would have been over $30,000 in the year. When we got her in the new plan, her out-of-pocket costs were $36 for the year. That's how big of a difference it can be.
Okay. So, and we're running out of time, so we're almost at the end of this list. We mentioned a little bit about Medigap, that it kind of pays for other things. Does it pay for the late fees?
No, Joe, please correct me if I'm wrong, but if you qualify for a supplement, it doesn't wipe out because the supplement is not income-based.
A supplement for what?
A Medicare supplement, Medigap.
Oh, yeah. No.
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 Oh, okay. They'll pay for all the other things, but not that. And then lastly, tell us a little bit about Medicare buy-in. What does it include? Pros and cons.
I'm gonna let Joe take that one.
Yeah, I mean, the Medicare buy-in is exactly what it sounds like. It just gives you the eligibility in order to have Medicare if you don't have enough quarters in. You can get the actual costs of it. Yeah, just for those that don't have enough quarters in, just like if you didn't qualify for Social Security disability, you
How many quarters do you typically need? Year quarters of working and paying
40?
taxes.
yeah, it's 40,
40.
which is about 10 years.
Okay. Gotcha.
Yep.
And it's and that's an income. It's based on your income, not your assets. Correct. That's what we mentioned.
A Medigap or a Medicare supplement doesn't look at your income as far as I've ever known.
Oh, for determining the price.
Yeah, I don't believe it's income based.
Oh,
Joe can correct me if I'm wrong, but
No, it's not. It's not income based at all.
no, they don't really care.
flat fee.
Right.
I feel
Okay.
like they deducted out of my Social Security to cover it, like per month. I mean, and each year, it goes up just a little bit more. So when Social Security goes up, then they take a little bit more to cover that because my work period of time was not 10 years. You know what I mean?
So imagine, Corey, if you will, someone 70 years old who's had their Medicare Part B premium paid the whole time they've been retired. They get a 2.5% COLA increase, and all of a sudden they don't, because they got an extra $30, they don't qualify for that to be paid now. So that extra $30 made them ineligible to pay the $185 premium.
Horrible.
And I've had that happen quite a few times where someone's only over by $6 or $7,
Oh,
and they're having to pay more than that, and having to pay full cost for drugs and everything like that. Yeah.
so it would have been better not to get that COLA, but they had to take the COLA.
Yeah.
What's a COLA?
Cost of living adjustment.
Oh, okay.
I don't know if we have time to get into this particular question, but I don't want to forget it. One of the biggest things we've been talking about as far as Medicare and social safety nets is how can we get healthcare costs completely covered, like universal healthcare, and it is Medicare. Can that be the example or a template of sorts if worked around? But I don't want to ask that yet. I know we got a couple more questions to get through, but I want to make sure
Well,
try to get you guys' opinion on it.
I've realized that when we're talking about Medicare, we're not talking about one thing here.
Nope.
There-
Absolutely not.
there's not 4 parts. There's about 12 parts. Half of them, or like, yeah, half of them are more than.
And if you don't
half
know
of
the
them,
rules, they're not forgiving.
no,
Yeah.
half of them sound like they're private. They're private company plans, and then the other half are public options, and then programs to help pay for the private part plans. And there's a lot of pitfalls and a lot of penalties and a lot of ways to get in trouble, not knowing that you're going to get in trouble for decades until you find out.
Yeah.
And
Here's the important thing. Everyone's situation is a little unique. That's why I can't push the SHIP office enough, because these people are adequate. They should be adequately trained to help people navigate this so that they don't mess up. The good thing about working with the SHIP office as well is if the SHIP offices messes up, there's forgiveness there and they can change, they can alter things. But if you do it and you mess up on your own and you're outside of the enrollment period, you're stuck. That makes sense? So
Yeah.
if
Yeah.
anything, if anybody takes anything away from this, SHIP office. Google
Which
your
stands
local
for?
SHIP office.
which stands for
Senior Health Insurance Information Program. SHIP, like a boat.
fantastic.
And those are free services. You should not pay anything for those services. And that is the best thing I can tell people. When you guys are getting ready to turn 65, go to your SHIP office so you get your guarantee issue for your Medigap or supplement. Otherwise, you can be subject to underwriting and you're not going to get it.
So
Oh,
So
I'm
based on
listening.
your experience now, how do you think this system could be improved to turn into a universal healthcare system, which is what it, as I mentioned at the beginning, like was the idea. It was kind of the aspiration, and then it had to get negotiated with private industry, all these different industry holders. You have the AMA representing providers, you have hospital systems, you have health insurance companies, and you have pharmaceutical companies being the main 4 industries that have historically been against universal healthcare. And instead of passing universal healthcare, we got this. Knowing the ins and outs, how do you think this could be improved?
boy, that's a $100 million
Yeah.
question.
Absolutely. I mean, the hardest part is knowing what the penalties are going to be. You know, every one of them is different. You know, I just had a consumer not that long ago who his wife had contacted me. He was in charge of his finances and he was getting dementia. He
Oh.
didn't pay his Part B premium, and if it goes for more than 6 months, you get canceled, and then you have 60 days to report that and pay your back wages. And if you don't do that within that time frame, you have to wait until the next enrollment period. Now he's going through and he's getting all this treatment for dementia, and he's having to pay 100% out of pocket because of the fact that he didn't do it within that time frame. So there's like these specific time frames, specific rules, and if you don't follow them, you're going to end up paying a fortune. And so I think that's the hardest thing. And you know, they send out that Medicare and Me book, and I highly recommend everybody read it in and out and backwards, forward. And I mean, as soon as you turn 65, you get flooded with information from Medicare, and it's overwhelming. And that's a problem that a lot of seniors have. That the second they're starting to turn that age, they just get overwhelmed with the amount of information. So going to a SHIP office or area agency on aging or independent living center and discussing, you know, what works for them is and what it could be the pitfalls of the program is definitely a start. But as far as making it close to universal health care and easy as possible, I don't think it's going to happen because you have those 4 different categories, like you were saying. You've got the pharmaceutical companies, you've got the private industry companies, and they all want a piece of it. And so they're going to be pulling in all different directions.
And John, you had brought up the point about the AMA. I know in another podcast when we spoke about it, I believe it was during the Medicaid, the idea of healthcare coverage for everyone, like you said, historically they were against, but they had like kind of reverse course a little bit later on regarding it because you kind of lose out too in the industry when you don't see that like look everybody needs it. It's not just only for certain amount of people. And Joe, you're right, like I have my Medicare book right in front of me right now that they sent out, so I'm looking through it. Even though I already have it, it's still good to be abreast on these things and the changes that they're making.
So I just throw something that's completely different. I was thinking about this past summer. I um, I was doing a adaptive sports program, and one of the girls that was working there, she was an intern from Germany, and she was here for 6 weeks. And I said to her, I said, "You like the state?" She says, "I absolutely love it." And I said, "You're thinking about moving here?" She says, "No, I'll never give up my free healthcare." And it's just like you talk to people from other countries, and it's amazing that we still have such a struggle.
Yeah, as I said, I went to Norway. Guy, taxi driver, his son had to be hospitalized, but he lived in a rural community, had to get flown there by a helicopter. I said, my first question was like, "Oh, did your insurance pay for that?" He said, "What's insurance?" It was totally
Wow.
free.
That'd be like
Totally
a
free.
$25,000 bill.
We do
Yeah.
not know what we're missing. I mean, we're not even getting to the question on fraud and abuse because I'm looking at we just dissected the Medicare program. There's so like this is a this is a maze designed to trap people. I don't know how else to look at it. And I mean, Corey, and to your point, the reason why the AMA representing providers supported the Affordable Care Act was because there was a carve out in the Affordable Care Act that didn't put caps on what they could charge. That was the only way they got their support.
That's
So like
interesting.
Yeah.
and you look at this Medicare thing, and people say, "Oh, Medicare sucks. It's so confusing." Because of that universal health care, like imagine if Medicare was for everyone. This sounds 100 times more confusing than my private insurance plan right now. But the reason why it's so confusing is because of how those players have forced policy to make so many compromises.
Yeah.
And it's insane. The
Wow.
Yep.
industries that are there to keep us healthy are actively engaged in sabotage of our health, it feels like.
And if you mess up, it's your fault. If you
Yeah.
make an honest mistake,
Yeah.
not enrolling in some, not doing something correct here, and one mistake individuals under 65 I see happen a lot. If you're working and your check pauses, you're going to start getting a quarterly bill for your Medicare Part B, and you cannot ignore that.
Yeah. And instead of it being billed monthly, if you're not receiving, if you're not taking Social Security, instead of it being billed monthly, you get when a lot of people they get worried because their first Part B premium will be for 3 months before and 3 months after. So
It's huge.
that's a considerable amount of money just to throw out just to get enrolled, and then they'll start being billed quarterly after that. And it's a lot of money for someone that isn't expecting it.
It
Yep.
says here on page 15, in most cases, if you don't sign up for Part B when you're first eligible, you may have a delay in getting Medicare Part B coverage in the future
Oh yeah.
because you can only sign up at certain times. You may also have to pay a late enrollment penalty that's added to your monthly premium for as long as you have a Part B plan.
As long
Okay.
as you live. Okay.
Yeah.
You're
All right.
married. You're married.
um, well, I think we should close it here before we make everyone insane. Um, I hope we can imagine and all of us in whatever capacity we have fight for uh, a simpler Medicare Medicare for All plan in the future. I encourage again everyone to check out this book, Medicare for All: Citizens Guide, that kind of lays out the history of it, a little bit of what I've mentioned, and you know, we need a better solution. But despite all of its terrible things, it sounds like Medicare is a really important resource
Yes.
that you should absolutely sign up for. Go to your local SHIP office if you're at 65 or older, and if you have a spinal cord injury or a disability, contact your local Center for Independent Living, like Independence Northwest in Connecticut, or contact Spinalpedia and get benefits counseling with Heather Miller.
Yep. Well, you think
So thank you,
Medicare is you
guys.
should get into SSDI and SSI rules
That'll be next
and
month.
some of the Medicaid buy-in rules.
That's next month, Heather. We can't take it.
Yeah.
Bloody
And so that's a great point, Jonathan, because that is why it's so important that things like SHIP and Centers for Independent Living are funded, because those are the people who are helping you understand this stuff that is almost impossible to navigate on your own. So we've got, it's important that those things are funded so that those people are there. Like I jokingly tell people, if people could understand Social Security, disability, and Medicare, I wouldn't have a job. There'd be no need for me. But
Yeah, imagine all the free time we would have if this system just.
Well, I'd have to find a new career, which would kind of stink, but I might be okay with that at that point.
You would be part of the government infrastructure, I'm sure.
If it simplified itself, because we can go down a rabbit hole with almost anything dealing with Medicare, Medicaid, disability, all of it.
But you know what? I think the most important thing that is coming from this conversation is that this is all the absolute truth, right? In an hour, we kind of have simplified what are the primary issues that are preventing a quote unquote socialized medicine. It's not the people, more of the waste, fraud, and abuse comes from it seemingly and systematically is keeping people in this like vicious cycle, and you really
Right.
don't know or understand any of this information until you get older. Like no one's telling you it in between the time you're an adult. Until then, you just start seeing the commercials, at home, right? And every time they tell you, hey, we're lifting up the retirement age, you're just kind of like, man, I got to keep on working. But what are you working for? What are you working for? What are you working towards? And that is to just generally speaking, stay healthy. So if we can,
Right.
somehow encourage people from jump, like including parents. I always have this conversation about like this, even with my kids, like, at a certain point in time, like you're not going to be covered by me for our
Right.
doctor's visits. Every time you get a cold and you're sick and you're like, oh, I got to go to the doctor, like I have to pay for these things. Here's how it works. I like to see us as parents and just everyday people just having more conversations like that in the school systems to prepare our young people for the future. So when you're like, oh, well, your grandkids and this and that and the third, they won't have, Medicare or Social Security in the future. Well, teach them. You got to tell them at some point. Don't let them wait till they're in a job field and they're wondering why, like, oh, why is this getting deducted? And I don't need this. It's like, you do need it. Should you break your leg or, something that's not covered by like your job or anything like that. But this has been such a wonderful, insightful conversation. I love when you guys
Agreed.
join us here on Super Adaptables. I really do.
Always a pleasure to join you guys.
And thank you for having me. Sorry I was a little bit late.
No, it's okay. You're doing something that we
You had an important thing going on.
oh yeah. Oh yeah, you did.
I appreciate it.
Oh, man.
All right, so Stain, thanks for participating, everyone, and for listening to this More Than Walking video podcast discussion. Stay tuned in and sign up for the More Than Walking newsletter at morethanwalking.com to learn about the topic we will cover next and how you can participate. Also, like, comment, and subscribe to our More Than Walking YouTube channel to watch each podcast, and we'll be dropping new episodes every week. Follow us wherever you listen to podcasts. Just search for More Than Walking or Super Adaptables.
Indeed. Until then, remain encouraged, stay hopeful, and above all else,
Keep adapting.